and 1.
Good afternoon, everybody, and a very warm welcome to the annual general meeting of the Cwmtaf Morgannwg University Health Board. Because of the COVID situation, we are live streaming this meeting rather than holding it physically for obvious reasons. But I hope that this gives many people an opportunity to join us via the internet. And we also have an option a little later on in the meeting for people to pose questions, and we will try to answer them during the meeting. So thank you very much and a very warm welcome. Can I just begin by saying a particular warm welcome to our new Chief Executive. We are delighted that Paul Mears joined us not 3 weeks ago as our new Chief Executive. So a very warm welcome to you, Paul, for your first annual general meeting of the Health Board.
Thank you.
And I also just wanted to pay particular tribute to your immediate predecessor as well, Sharon Hopkins, who was our interim chief exec for I think about 14 months in the lead up to your appointment. We owe Sharon a great debt. She was an inspirational leader coming into the Health Board, dealing with a number of very acute issues. And provided exceptional leadership and helped set the Health Board on a stable platform for our future development. So I wanted just to say a particular thank you to Sharon for her contribution for much of the year that we are actually reviewing this afternoon. So this is the annual general meeting for the year that ended at the end of March of this year. So we're slightly behind times, again because of COVID. But in a minute, we're just going to show a short video which tries to capture a true flavour of this year that we're talking about in the life of the Health Board. And as you will see, this has been a very unusual year. It started with a huge set of challenges around our maternity services and a massive challenge for us to learn from the experience of women who have been through the maternity service over many years. And we are currently right in the middle of learning those lessons and improving our services in conjunction with women and families who have used them. It was also a big year because the boundaries of the Health Board changed. So the Bridgend County Borough Council area joined the Health Board. So that was another major challenge. And then, of course, 3/4 of the way through, one of the worst pandemics to hit the country for decades affected our communities particularly bitterly. And we are still absolutely in the middle of dealing with that crisis. And all of that, of course, on top of the normal business of the Health Board, treating hundreds of thousands of people who come into our clinics every year, GPs seeing hundreds and hundreds and hundreds of patients every single day, dentists, optometrists, pharmacists, and all of the many different professions within the Health Board boundaries, providing that care and that expertise is the core business of the Health Board. So that's a quick outline of the year we're going to review. We've now have a video which I think lasts about a quarter of an hour, which tries to capture a cross representative sample of some of that story. Thank you.
For so many reasons, the year 2019 to 2020 has been a time of unprecedented change for our health board. Incorporating Bridgend from the west of the region in 2019, Cwmtaf Morgannwg University Health Board became a new entity in a year that has been one of our most challenging yet. Even before the challenges posed by COVID, this was a 12 months of significant reflection and action for the new health board. Not only have we been busy making all of the critical decisions needed in the establishment of the new CTM Health Board, we have had to reflect on failings in maternity services of the former Cwmtaf University Health Board, as well as the wider concerns raised by Welsh Government, Wales Audit Office and Healthcare Inspectorate regarding quality, culture, leadership and governance. From this period of reflection, we have learned serious lessons which are now shaping everything that we do. The considerable scale of the challenge to achieve sustainable change and improvement faced in this year will be one we continue to face in the year ahead. However, we are committed to addressing these challenges in an open and transparent manner and in dialogue with our local populations. This short video captures the many improvements that are being made in our health board. As a board, we are fully committed to ensuring that people, quality and safety are at the heart of everything we do. On the 1st of April 2019, Cwmtaf Morgannwg University Health Board was formed. The Welsh Government decision saw the transfer of responsibility for the commissioning of healthcare in the Bridgend area from the then Abertawe Bro Morgannwg University Health Board to the newly created CTM Health Board. This was no insignificant change. As a new University Health Board, CTM became responsible for the commissioning of healthcare for a population of around 450,000 people across communities in Bridgend, Rhondda Cynon Taf and Merthyr Tydfil. With an increased workforce of 12,000 staff, our estate grew to span 3 large acute hospital sites, along with community hospitals and primary care services. These include our GP surgeries, dental practices, optometry practices and community pharmacies, in addition to facilitating more specialised health services where these are not provided within our boundaries.
There is no doubt that the challenges of 1920 have been tough, but it is the approach that we've taken to meet these challenges face on that has been most significant. We have committed to making important changes to the way in which we work, all of which has helped us to steadily rebuild trust and confidence in our organisation. In April 19, we received a critical report from the Royal College of Obstetricians and Midwives for maternity services at both Prince Charles and the Royal Glamorgan hospitals. We immediately issued a formal apologies for the failings and put into place a robust maternity improvement programme. As part of this programme, we have been capturing the insight, experience and thoughts of women and their families, as well as developing systems to better measure effective practice and rigorous instant reporting. Later in the year, an independent maternity oversight panel commissioned by the Welsh Health Minister reported that our improvements were being built on solid foundations. our progress is firmly on track to not only deliver against the recommendations, but also to deliver a maternity service of which staff and the local communities can be proud. As a newly established health board, it was imperative that we devise a set of values and behaviours which truly reflect the ambitions of our organisation and the communities we serve. During the year, we launched a programme of valuable conversations with our local population, which resulted in over 4,000 interactions via staff and patient workshops and surveys. The findings informed the thinking behind CTM's mission and vision statement, which was approved by the board in January 2020, and a reflective set of values and behaviours which went on to be approved by the board in July. Community engagement was also key when it came to the proposed changes to our A&E services at the Royal Glamorgan Hospital. A series of community-based engagement events helped shape the thinking that resulted in the service being more sustainable and ultimately retained as a 24-hour provision. We were able to address safety concerns, and we are proud of the quality of these services as they continue to improve. While strengthening our internal processes was already high on the agenda, following a critical review of our quality governance arrangements in the summer of 2019 by the Wales Audit Office and Healthcare Inspectorate Wales, we also set about making robust changes to our quality and governance processes and risk management.
The past 12 months have seen significant developments across our services, and the following examples are some of our improvements. As part of the changes to our maternity services and the way we provide them, saw the formal opening of our pioneering Tyrian Birth Centre at the Royal Glamorgan Hospital, which took place in March 2020. This state-of-the-art facility is specifically designed around the needs of women and their partners. The intimate birthing environment allows for strong bonds to be made between the staff and the women who give birth there. We have and are in the process of investing £8 million to transform health services at the former Dewi Sant Hospital site in Pontypridd, enabling its transformation into a health park. A state-of-the-art Macmillan Palliative Care Unit, a Bothin, opened its doors at the Royal Glamorgan Hospital, which provides a unique service for our communities. A 2-year pilot scheme, Choice, is another of our examples where an outreach project was launched to deliver a targeted sexual health education programme and long-acting reversible contraception service to vulnerable women at risk of unintended pregnancy. This pilot project will deliver a new service to target, promote and provide education for women of childbearing age in vulnerable groups in our communities. An arts and health programme was launched aiming to boost well-being among patients and communities as is part of our health and wellbeing strategy. It includes, in partnership with the Arts Council in Wales, the employment of an arts and health coordinator who joined us in September 2019. Our Healthy School and Preschool scheme aims to take a whole school approach to address 7 health topics among our young people. Every school in Cwm Taf Morgannwg is enrolled in the scheme, which covers topics such as healthy eating, fitness, physical and emotional health, and substance misuse and safety. We know that partnership working benefits patients in our communities. In January 2019, our physiotherapists teamed up with Merthyr Tydfil Leisure Centre to provide physiotherapy rehabilitation to patients in the community. These patients needed treatment for anterior cruciate ligament. This proved to be very successful in the rehabilitation of people suffering with this problem. Another unique partnership is between medics in South Wales and the South Pacific, which is underway. The purpose being to fund medical supplies and send health professionals to the island communities to teach new skills. There has been many opportunities to celebrate achievements during the year, some of which are the following. Firstly, our Staff Recognition Awards highlighted the many examples of best practice within the Health Board. These have improved the quality and safety of our services, ranging from leadership to improving the patient's experience and our partnership working. Our successful community hospital, Ysbyty Cymronda, celebrated its 10th anniversary with the help of the 10 of Us choir at the beginning of the year. This was a great accolade and saw many staff and patients, old and new, attend to celebrate with us. Furthermore, the staff at the Princess of Wales Hospital were delighted in receiving global recognition for work to support newborn babies and their families. The staff in the Special Care Baby Unit were also the first in Wales to achieve Stage 3 Baby Friendly Initiative accreditation. Also, Jay Benjamin, one of our occupational therapy assistants in the Royal Glamorgan Hospital, was the Wales Regional winner of the Our Health Heroes Clinical Support Worker of the Year. Finally, congratulations also go to our practice nurses at the new T Newydd General Practitioner Surgery in Treherbert. Brianna David and Alice Lewis, who were runners-up at the Royal College of Nursing Nurse of the Year Awards in 2019.
Unprecedented times challenged everything for us when in March this year the World Health Organization declared COVID-19, coronavirus, a pandemic. CTM, along with the rest of the NHS across the UK, faced extraordinary and increasing service pressures which demanded a new dynamic and agile response. Our staff display amazing dedication and strength, continuing to work tirelessly and selflessly to care for our communities during these challenging times. We cannot thank you all enough. Our thanks also go to our communities. Their valuable contributions helped us in our response to COVID-19. We have been overwhelmed by the many expressions of gratitude and mountains of donations received in the form of toiletries, food packages, equipment and other essentials, all of which have helped staff and patients so much over our recent months. We are particularly proud of anaesthetics trainee Helen Iliff, who teamed up with Baroness Elora Finlay to develop an innovative pin badge to encourage social distancing. As you may have seen in the UK media, this has been part of a national campaign to protect people who have been shielding from COVID. As we head into another year of uncertainty, one thing that we can be sure of is that the need to respond and recover from the COVID pandemic will be with us throughout 2020 to 2021 and beyond. The very many unknowns mean that as an organisation, we will need to be adaptable. As we go into the winter months, we remain agile and prepared. We have retained important bed capacity in our field hospital and are recruiting to our workforce so that we are in the very best position to respond to any demands that come our way. And we are delighted to have recently recruited a new Chief Executive to take the Health Board through to the next chapter in its history.
Hello everybody, my name is Paul Mears. I'm the new Chief Executive at the South Morgana Health Board. It's really great to be able to give some input into this AGM. This is the end of my first week in the organisation, so obviously I can't take credit for any of the great work that's gone on over the past 12 months, but I'm really looking forward to working with the staff, the stakeholders, the communities that we serve to develop the services we provide in the organisation and think about how we can continue the journey that the organisation's been on over the past year or so. Obviously we've got our challenges, the particular challenges facing us around winter coming up and the ongoing management of the COVID-19 situation. but I've been really impressed already in the first week when I've been here with the commitment, the support of the staff across the organisation and the real determination to do the best for our local communities and our patients. So I'm really excited about the opportunity to come in now and lead the organisation as we move forward into the next year, and hopefully look forward to working with many of you who are watching our AGM today as we move into the next year and what that will bring for us at Cwmtaf Morgannwg.
We hope that this video has given you an understanding of some of the challenges we have faced and the successes which we have celebrated at CTM this year. We are proud of our staff and remain committed to delivering the very best services for our communities.
I hope you found that helpful, and a thanks to the team who put together the video. Our intention was to give you a representative cross-section of what's been going on during these 12 months. So we come on to the slightly more formal element of the business now. There are two key documents really: the annual report for the year in question, and its a companion document, the annual quality statement. And I'm going to ask George Gillespie, our Director of Corporate Governance, just to talk us through those two key documents. George.
Thank you, Chair, and thanks for the opportunity to present the first annual report as your Director of Corporate Governance in CTM. I'm acutely aware that traditionally annual reports are lengthy documents that very few folks read in detail, so I do hope you found the video a little bit more engaging and accessible and informative way of summarising our year. There may, however, be some of you who wish to learn a little bit more about our challenges, opportunities and achievements across the Health Board, and thanks to a collective effort from a team of colleagues who've authored and undertaken widespread engagement on their development, you'll find a suite of documents available on our website. They're available under Health Board meetings, but this week they're featured as a banner at the main homepage at cwmtafmorgannwg.wales. Hard copies are also available if anybody would like one. And the suite of documents really for our annual report are made up of our performance report, which details how we've performed against our targets and how we seek to maintain and improve our performance further. Our accountability report, providing information about how we manage and control our resources and risks to comply with our own governance arrangements. And our financial statements, which you'll hear a little bit more about from our Director of Finance, who's coming in shortly. You'll also find our annual quality statement, which highlights the actions taken to improve the quality of our services over the year. All board colleagues are very well cited on these documents. We've shared them on many occasions through the drafting process, but very happy to take any comments or queries from colleagues and urge you to read them. Thanks, Marcus.
George, thanks very much indeed. That's very helpful. And as you say, we come to the finance update. There is financial information in the statement, but we thought it'd be very helpful if Steve Webster, our Director of Finance, just brought us up to date and presented the overview, really. Steve.
Yes, thanks, Marcus. I've just got a small number of slides to take you through. So if those could come up, I will talk you through them. Okay, so it's a very brief financial overview of the year, and we start off with just an introduction on the next slide that just sets out that Cwmtaf, if the slide can move on, please. Thanks. Yes, so Cwmtaf Morgannwg hosts the WISC Specialised Services Committee in the East Emergency Ambulance Services Committee. So the financial information for those hosted organisations are within our accounts, but in the accounts the CUMTAF only figures are separated out. This presentation is only focused on the pure CUMTAF Morgannwg UHB figures, and I'm going to cover the key financial targets, and if we can move on to the next slide, and I'll go through the key financial targets. So, as in previous years, we've achieved our revenue target, living within the revenue resource limit, and the capital target and the payment target. So I'll just go into just a bit more detail on each of those three. So if we could move on. So this one shows the revenue limits. So you can see there the net operating expenses of the organisation as against the resource limit, and that in each of the last 3 years we've been within that resource limit. The most interesting thing from this slide is just the scale of the increase in the organisation in 1920 from the incorporation of the Bridgend area. That's an increase of over 50%, and clearly a big increase in the scale and scope of the organisation. So if we can move on to the next one. The capital resource limit. This shows we're only marginally under, which is where we want to be, the capital resource limit for the year. This 38 million of expenditure would have covered a wide range of equipment replacement, backlog maintenance work, IT work, but also some of our major schemes, such as the Dewi Sant scheme that Maria was covering in the video, and the other major scheme would be the phase 1B of the PCH refurbishment. And of course, we're hoping that will go on to phase 2 shortly. So that's our capital expenditure. And then finally, on the next slide, this shows our payment performance, so that we are paying over the 95% of all non-NHS invoices within 30 days, which is the target, and is an important target in the current time in particular, where a lot of our local businesses are challenged financially due to the COVID outbreak. So if we can move on a little bit further, there's a couple of slides now just going into a bit more detail on the year-on-year change between 18-19 and 19-20. This gives the expenditure figures broken down by, if you like, healthcare sector, and on the next slide it just gives some of the percentage changes. So you can sort of see there all, as you would expect from the incorporation of Bridgend, all our areas of expenditure increasing at a significant rate. One thing that's pleasing about this slide, I think, is that the expenditure on primary healthcare has increased at a faster rate than other sectors. The other provider expenditure increasing a bit more is due to the nature of the services in Bridgend, but the particular point to pick up there is the increase in primary healthcare at 59% is bigger than the increase in hospital and community health services. And some of that investment that's been directed from Welsh Government funding into primary care is starting to show through, so that's pleasing. If we can move on. This slide just shows some of the sort of key changes in the year that have allowed us to break even. I think the key message from the figures at the top there are that, as we know, funding for our core services increases at a slower rate than demand from healthcare demand increasing and from inflation and so forth. So to maintain break-even within the resources we've got, we have to achieve annual efficiencies, and this shows that with the 10 million of efficiencies that we achieved in the year, we made a small surplus of 0.9 million. That's the in-year position. Of course, we have a major focus as well on the underlying position, the recurring position, and that wasn't quite such a good position as the in-year, and our recurrent deficit increased in the year for a number of reasons that are shown there, and in particular the Bridgend services transferring in brought an inherent deficit, if you like, that's affected our recurrent financial position, amongst other things, as we sort of go forward. But in year, we achieved a surplus of 0.9 million. And if we can move on. Finally, the balance sheet, and you can see here that all our sort of asset figures have increased year on year again. The major factor there is the Bridgend transfer, but a important point is that the total new capital investment that you can see there of 40 million is bigger than the annual depreciation, which means we are spending more on new assets, equipment and buildings and so forth than the rate we're depreciating our existing buildings. So we're keeping up in broad terms with equipment replacement and building updates. I think those are the key points, but obviously I will take any questions.
Thanks very much indeed, Steve. That's very helpful. It's startling in a way, isn't it, to think that we spend something like £3 million a day of public money caring for people in Cwmtaf, Morgannwg, and helping to increase the health of the population. It's a large business, but of course the purpose of the health board, the health board doesn't exist to break even. The health board exists to improve people's health and to provide excellent care. But on the other hand, if we don't break even, if we don't manage our resources, then we don't do what it is that we're set up to do to the best effect. And it's a great tribute, I think, to our staff that we do manage within our resources. And I think the shift that Steve has highlighted there of investment towards primary care is another very important thing. It's easy to say, it's a fundamental issue for the health service and sustainability for us to provide more care closer to home than always requiring people to come into hospital. So that, I think, in strategic terms is a significant achievement too. Steve, thank you very much for that. And again, for members of the public who are tuning in, if you wish to ask a question, then please do so, and we'll do our best in the time available to answer any questions that have come in. Steve, thank you very much. So our next item on the agenda, item 5, is the question and answer session. And as I say, this is open for members of the public, please to raise questions or to make comments and observations if you wish to do so. We've certainly had one question in so far, and maybe Paul, I'll ask you perhaps to address this now in this session. So we've had a question from a member of the public around when can we, I'll read the question, when can we expect services to return to the Royal Glamorgan Hospital?
Thank you, Marcus. Well, obviously, as many people on this AGM will know and people watching will know, we've had to make the difficult decision today to temporarily divert emergency admissions away from the Royal Glamorgan Hospital due to the outbreak of COVID-19 within the wards at Royal Glamorgan. Obviously, this is a decision which we didn't take very lightly, but we had to take on the balance of risk in terms of the risk to patients and staff within the Royal Glamorgan and potentially patients who would be coming in to that hospital. And so the decision was made with patients being diverted to Prince Charles Hospital, Princess of Wales Hospital, and a small number of patients going down to Cardiff as well. In terms of how quickly we plan to restart in non-elective admissions, obviously that's really going to depend on how quickly we can start to see the situation at the Royal Glamorgan improve. We would expect that over the next few days the numbers may continue to rise. We're obviously doing more proactive testing there, which of both staff and patients, so that could mean that we'll find further cases that were not previously noted because they weren't symptomatic, but obviously we will be reviewing the position on a daily basis, and as soon as we are comfortable and in collaboration with colleagues at Public Health Wales that they are comfortable that the numbers are stabilised and beginning to decline, and that we are confident that we can manage the situation effectively at the RGH, we will obviously look to restart the non-elective activity into that hospital.
Thanks, Paul. We've had another question which is, I think, quite closely related, really, and to some extent you've answered it already, but perhaps you could just address this specifically. So somebody has asked, I'm waiting for surgery at the Royal Glamorgan Hospital. What happens with that now?
Well, at the moment, the planned operations that were scheduled for this week at the Royal Glamorgan have been cancelled, apart from 3 cancer cases that were of clinical priority that they needed to be done this week. We appreciate very much that this is a really frustrating decision for a lot of patients who've been waiting a long time for their operations. Obviously, what we will be doing is reviewing, as I said, the situation on a daily basis, and not just about the emergency patients coming through, but also patients who have booked for planned surgery. And we will be communicating actively with those patients whose operations have been cancelled to inform them about when we'll be able to bring them back in. But we will obviously, I know it's not a very good answer to be able to give because we can't give definitive dates at this stage, but we would hope to make sure that we're keeping the information flowing back and forth to our patients who are waiting for planned surgery, so they know as quickly as possible as we do when we're going to be able to bring those operations back online.
Thanks, Paul. That's very helpful. We had a discussion, in fact, in the Health Board meeting this morning, didn't we, about the need to return the capacity, particularly in our hospitals, but also in primary care, return that capacity to something near the level that it needs to be to meet the health needs of our population. And that's been hugely challenging, but I think everybody is acutely aware that with every week that passes, there are more and more people who are having to wait for treatment that they would have received before COVID, and you and the team are doing everything you possibly can to narrow that gap between what we can.
Absolutely, Marcus, and I think obviously this is important to say this isn't just a Cwmtaf Morgannwg problem. This is a UK NHS wide challenge that every hospital in the country is trying to wrestle with at the moment, about trying to bring back on stream as much of our planned operating as possible, whilst recognising that the restrictions around things like infection control mean that some of the number of cases we can get through an operating theatre or the number of beds we can be using may not be as high as it was pre-COVID due to the intensive cleaning regimes and things that we have to have in place to manage infection control processes. So our operational capability is going to be more constrained because of that. And then obviously now with the Royal Glamorgan particularly, having to take out those services completely has set us back slightly on that site. But it is a very careful balancing, and I should also say that every patient on the waiting list has been clinically assessed to make sure that patients of clinical high priority are being prioritised for treatment. So just to reassure that we are making sure that we're doing everything possible to ensure that patients are being treated in clinical priority.
Super, thank you very much. Paul, the next item on the agenda is closing remarks, but let me just deviate from the agenda, if I may, just slightly. Because it's great to have you joining us, and in a sense you're sort of seeing things with fresh eyes, aren't you? Inevitably coming into Wales, into this health board, seeing the new setup. I think people might be interested in your personal take on all of that, and what have you learned in the last 2 or 3 weeks?
2 or 3 weeks. Thanks, Marcus. Yes, as you say, there is a bit of a steep learning curve for me at the moment in terms of getting to know the Welsh system, getting to know this particular geography of Wales and services that we provide in the Health Board. I guess, first of all, having been around over to a number of sites in the first couple of weeks and met lots of staff, one of the things I would say was that despite the challenges that everyone's dealing with COVID-19, I've been really impressed by the level of sort of positivity and commitment that I've seen in our staff. Yes, absolutely, people were telling me about the pressures and how it's feeling really difficult and tough on a day-to-day basis, but they also recognise there are some really opportunities for the Health Board to improve and do better for our populations. Greg mentioned in the video about the work on maternity. I've spent time with midwives in both Prince Charles and Princess of Wales and heard from them about the improvements that they've seen and how families are experiencing services now, and that's really, really encouraging. I've heard from lots of clinical teams, doctors, nurses, therapists and others about lots of ideas for how services could be improved. One of the things I think has really struck me is, which we haven't touched on, is, as well as the terrible things that people have had to be dealing with COVID, COVID has also forced us to think about doing things in different ways. So if you look at what's gone on over the past few months here, a large amount of care has been shifted into different settings, whether that's about, you know, caring for more people in their own homes, or indeed caring for people using digital technologies. I've heard from lots of clinicians about how they're using now digital consultations over video to actually engage with patients, and actually how for a lot of patients there's been really positive feedback about that, and how more convenient for a lot of patients it is to be able to talk to their doctor or therapist or nurse over a video consult than having to take time out to go into a clinic or a hospital to see people. So I think one of the things I've picked up a lot is bizarrely some of the positives, if there are positives out of a crisis like this. There are some things that I think people feel have been a good thing, and particularly also the team ethos that's really come to bear. Everyone's really pulled together. It's brought people together across sites, across specialties, across primary care, secondary care, community, mental health. Everybody's really come together and supported each other to try and get through a very difficult situation. I think also everybody would also say, I think, as they always do when they have a new person coming in, you know, there are things that need to be improved. I think people have recognised that in line with many of the recommendations that have come through from the various external reviews, that the Health Board is going through on a journey in terms of changing the culture and its ways of working. I think we've got a new model of a new operating model that was implemented earlier this year, which is very much focused around how we build the strength and capabilities in our localities. The 3 localities of Bridgend, RTE and Merthyr Canon. And I think that's really a really good way forward in terms of promoting that integration of care between hospital, GP, community services, mental health, voluntary sector. So that has a lot of strengths, I think. But also, I think, a great deal of opportunities and points that people have raised with me about how we as an organisation behave, how we care for our staff and support our staff, not just through these difficult times, but on an ongoing basis, and making sure that we continue to build the work that I know you and colleagues on the board have already started around, you know, really creating a feeling of openness and transparency across the organisation, where people, frontline staff, feel able to raise concerns, put forward ideas for improvement, feel that we're all trying to work together to the same purpose, which is about improving health for our population. I think the other thing I would just say also, which has really impressed me, is also the level of engagement and positive feedback I've had from initial conversations with key stakeholders. So local councils, MPs, MSs, all really keen to see the Health Board succeed and to have a real positive impact. And we shouldn't forget that COVID aside, we serve a population that have some of the most difficult public health issues in Wales and indeed the UK, and have some, and there's very clear evidence that the health outcomes of some of our populations are not as good as we would want them to be. Now, clearly, we have a role to play in that as the Health Board, but there's a lot of evidence that's out there that says health and well-being of populations does, I think about 10% of it is actually about health services, 90% of it is about other factors in their lives, such as employment, housing, education, all sorts of other things. So we're only going to be able to make an impact on the health and well-being of our populations if we work collaboratively with our partners. And I think we've got some really great foundations here in this patch with our partner organisations. But certainly what I want to try and do, and with colleagues like Kelechi in public health and others, is really think about how could we start to look at really putting in place some sort of innovative solutions with our partners to really try and shift some of these sort of long-standing metrics that have been stubbornly slow to improve in terms of more strategic outcomes for our population. So a lot to do, but a great place to come and work.
Thanks, Paul. That's lovely. And as you say, some significant challenges, but I think our communities are one of our biggest assets as well, aren't we? That sounds a bit twee, but it's not at all. You know, the strength of these communities, yeah, we've seen time and time again, and that's, I'm sure, what the future will be built on. We've got a few more questions coming in, and I think we've got a few more minutes, so let's take a few more of these questions. So the next question we've got here that a member of the public has asked is, why aren't you sending all COVID patients to the field hospital and keeping the Royal Glam for emergencies and incoming patients?
Well, I'll go at this, and Alan Laurie, our Director of Ops, might want to come in and give further detail. I mean, the field hospital, as many people will know, it was set up originally when the first wave of COVID hit, and it has been sort of mothballed for a period of time pending any future need. We're currently actively looking at how we might use the field hospital in light of the current challenges at the Royal Glamorgan. One of the big challenges we obviously have with these situations is we really try to restrict moving people around. particularly when we're unsure of their COVID status. So if we do look to use the field hospital, I think what we will look to do is use it as a step down facility where we can take people who perhaps don't need sort of acute medical care, but still need an ongoing sort of oversight from nursing staff and therapy staff to help with their rehabilitation to get them home. And that's one of the things that we're looking at the moment. But Alan might want to come in and give further detail on that.
Thank you, Paul. Thank you, Marcus. Yes, that's absolutely the rationale for it. When we set the field hospital up in the first instance, in the first wave of the pandemic, it was very much around for patients who are ending their treatment journey, who didn't require district general hospital care, but actually required some continued care and treatments and rehabilitation before they're able to be discharged home or discharged to a care home or a nursing home, etc. And that's exactly the same approach we're taking now. It's around the level of care that doesn't require a district general hospital and potential access to critical care facilities, etc. We took a very clear decision at the very beginning that we weren't going to have piped oxygen, for example, so that limits the sorts of patients that you would have within that sort of facility. But we know we have a number of patients across both the Royal Glamorgan, POW, PCH and our community hospitals as well, who we could transfer appropriately to a properly staffed field hospital. But we're working that through at the moment because, as Paul says, we want to do that safely. And we want to make sure we minimise patient transfers because to move patients around on a regular basis is not a good thing to do. You want one move and then back to their normal place of residence.
Thanks, Alan. That's very helpful. Another question from a member of the public. You have posted about a community partnership panel. Can you explain more about this and what it will entail and what are you looking for? So this is in relation, I think, to the work on emergency services, particularly around the Royal Glamorgan Hospital and serving the populations of Rhondda and Taff Ely. Paul, do you want to respond on that one?
Yes, as you say, Marcus, this was in response to the conversations we had with the community earlier in the year about the future of A&E services at Royal Glamorgan. I think as part of that process, clearly there was a lot of concern publicly about the future models, service models at Royal Glamorgan, and clearly we want to make sure that whilst we've made the decision to keep the services at Royal Glamorgan, we want to have conversations with the local community about how we develop that further, particularly not just around the A&E, but the wider approach to dealing with minor injuries in the local community. So the panel, I think, and again others may correct me because I'm learning here, the panel is being established to give a forum where local people can put themselves forward to be part of the panel and act as a sort of sounding board for the health board to be part of the conversation around how we develop the service models in that particular part of our patch. I don't know if Claire or anyone else wants to jump in there if they know a bit more about this than me.
I guess particularly we may be looking, well, I know we are looking for members of the public to join in. So part of the question was, what would it entail and what are we looking for? Maybe Claire, you could say something about that?
Yeah, by all means. So at the moment, we are looking to establish the participation panel to help us shape particularly those services that are emergency services, those ones where we have to make sure that we're making the right choices and providing the right offer around our minor injuries units or our emergency department units. So it's got a very very narrow focus at the moment, and we'll learn and we'll test how that process evolves over the coming months. Requests have gone out through community groups and interested people to look for membership of that participation panel, and I think we heard at our board meeting this morning how we have had a lot of interest in joining such a panel, and we'll look to make sure that we build on that and grow that offer from the public of our participating in developing our services, so that we can make sure that we use that learning from an emergency services perspective, but actually then go to broaden it. We've also, via our CTM Facebook page and on Twitter, sought representation from members of the public to be able to join that panel.
Thank you, Claire. That's very helpful. And just on the back of that, a slightly different but related point. If anybody is interested potentially in becoming a member of the health board, we are likely to have a vacancy in the near future. This is a ministerial appointment, but if anybody is potentially interested in becoming an independent member of the Health Board, I will be very happy to have conversations with people about what it involves and how to express an interest if you wish to do so. So there's an open invitation there to anybody who might be interested in that. And then we have another question from a member of the public. This is a huge question, but a very, very good one. So how do you expect digital to transform CTM services over the next 12 months? And I can see Claire smiling, so that's good enough for me. Do you want to kick off on that one, Claire?
Yeah, of course, Marcus. Well, firstly, I think before we look forward, we need to look back. We probably need to look back 12 months to where we were in terms of the digital landscape in the Health Board, where we had a relatively safe and steady strategy in terms of our digital approach, and the change and the dynamic change, the pace of change that COVID has brought along, and the opportunity of the last 6 months to really demonstrate the benefits of digital to us working in the Health Board, to our clinicians, and to, more importantly, to patients, to try to make sure that our services are accessible, that information flows between ourselves and patients are as up to date as possible, making sure that we use the information that we are gathering to share that back and inform our decision making, because becoming more and more digitally enabled means that we can also make more informed decisions and use the data that we are gathering and the information that we collect to help inform the decisions that we're making. So it's been a rapid growth for us. Today we are via Teams. We've had our board meeting, we're having our AGM, and this is technology that we're all getting to grips with. We now are able to very successfully offer virtual outpatient appointments to those who aren't able to join us in a traditional outpatient setting. Our GP colleagues are more easily able to contact their secondary care consultant colleagues to ask for advice, to try and prevent unnecessary referrals and admissions into secondary care. And so that picture is slowly but surely building. Members will be aware that by Christmas time we'll be looking to instigate a digital patient record, so that all of those paper records, that sign of archaic times, the paper record, as of Christmas time we will have those online, and we will be able to access those alongside a virtual clinic. Our clinicians will be able to see a digital record at the same time. We've got a lot of really solid building blocks in our Health Board in terms of digital change, and I think our focus for the next 12 months, to draw back to the question that we were asked, was to make sure that we put all of those building blocks together and really deliver population, and for our clinical staff in particular, something that is effective and efficient, and is seamlessly in the background of what is just really good clinical care.
Claire, thank you. That's an excellent answer. So much is covered, isn't it, under that one word, digital, and there aren't many things that have the capacity to transform pretty much every single thing we do, but everything under that digital umbrella, I think, together does genuinely have that capacity over the next few years, decade or so, to change the face of the health service, and we need to absolutely make the very best of that and not be a laggard. So Claire, thank you very much for that. That's very helpful. Just to point out, in relation to the question we had earlier about the public panel, I think the closing date for people who are interested in joining it is the 9th of October. So there's still time for anybody who would like to join the panel just to put their hand up, and all contributions will be very warmly welcomed. So thank you. I think that covers the questions we've been asked. This is a bit of an experiment, really, doing it like this, but I think it's working very nicely. The final item on the agenda then is just some closing remarks. Paul, perhaps we could come to you, and then I'll just bring things to a close. So because I mucked around with the agenda earlier, you've probably said a number of the things you were intending to. But any final thoughts to leave us with?
No, I don't think so. I mean, I think just to say, obviously, Marcus, you know, as you were saying earlier in your introduction, and indeed the video described it very eloquently, you know, we have had a really challenging year over the past 12 months, and there clearly we are still in a very challenging year, this current year we're in, but that I think, you know, we need to recognise the massive contribution of our staff in this organisation to helping maintain services for our population. It's been really challenging, but I know, as I said earlier, that everyone is really committed to trying to maintain the services and keep things going, because staff, just as much as patients, want people to be able to get services when they need them and be able to see them and provide the right treatment at the right time. So I think we are absolutely committed to that in terms of trying to do the best we can do for our population, and our staff are motivated to do it. And also just to say, you know, thank you to all of our communities and our stakeholders, really, because I think, you know, we can only achieve what we want to do by working collaboratively with other people, and I think we see an ever increasing collaboration with key stakeholders and communities. And certainly my commitment moving forward that we want to maintain and build on those relationships and extend them indeed to other people perhaps we haven't engaged as much with more recently. But yes, we are in challenging times. We're in a difficult place, but I'm sure together, working together as a health board and with our partners, we will be able to take the organisation forward and continue to provide the best care to our local communities.
Paul, thank you very much. So it just leaves me to draw proceedings to a close. I hope you found this a useful session, and we'd be very grateful for any feedback, really, on how we can make it better in the future. I think the Health Board is absolutely clear about what it's here to do. It is here to improve the health of our population and to provide the very best possible care we can for people who need our services. That's all we're here for, and that's what we will do everything to achieve. We need to balance the books, and we will balance the books. We need to make sure that our staff morale is as high as it can be, and we will do all that we can in that space too. And we need to focus on our values and behaviours, and that's another huge area of work that the Health Board is focusing on. But we're very clear what our purpose is, and we, I think, are all very privileged to serve these particular communities. One of the things that was abundantly clear in the discussions that we had, sometimes very difficult discussions, about the emergency department at the Royal Glamorgan Hospital, is the strength of feeling and the huge strengths of our communities that shone out during that consultation. And I hope we as a health board demonstrated that we really did listen, and that we did all that we could to provide the services that the people said that they wanted and needed. And I think that is looking in a much better position now than it was a little while ago. So thank you all very much indeed. I hope this has been a useful session. Please give us some feedback. Otherwise, thank you all very much.